Good afternoon, media friends. Welcome to the press briefing today. Today we have three doctors. They are Dr. Edwin Choi, controller of the CHP, Dr. Chang Shuk Kwan, head of communicable disease branch of the CHP, and Dr. Sarah Ho from the HA. Now, Dr. Choi, please. Members of the public and media friends, good afternoon. Now about the latest updates of the situation. The situation is very critical. Every day, the number of cases that we have reported is on a rising trend. Our work is under pressure, and we understand members of the public are anxious. On testing, members of the public have been cooperative in terms of voluntary and compulsory testing. Because of the sheer number of samples submitted, waiting time is long. You may have to wait a few days before you get the result. The government is raising the testing capacity of laboratories, including the Huoyan laboratory. With the support of mainland experts, we believe that in a short time, we can increase our local testing capacity so that the waiting time can be further reduced. On the other hand, for notices of compulsory notices of confirmed results or preliminary confirmed results for those waiting at home, I understand that people are anxious. We are doing our best to increase the number of community isolation facilities. Now, the hotel room isolation plan is in progress. Several hotels have joined the scheme, and also we have commissioned the remaining phases of the Penny's Bay facilities. Together with the Kai Tak site, there will be a total of 10,000 community isolation and treatment facilities, which will drastically improve our capacity to take in patients. With the limited facilities, we have to reserve the hospital beds for people with high risk. For those who don't have any symptoms or at a stable condition, they may have to wait at home for a bit. We are doing our best to send patients to hospitals and isolation facilities. For patients waiting at home with no or mild symptoms or preliminarily positive patients, we urge them to adopt infection control measures. First, you should separate with the family members and take your body temperature regularly. And you should pay attention to the updates and guidelines in terms of infection control on our website. On the thematic websites and the HA websites, you can have access to the most reliable information. For patients with no or mild symptoms, the government and the HA are offering appropriate treatments to them. While staying at home, you must pay close attention to your health. For people who have been vaccinated, usually the symptoms would be mild. If there is any change, you should call our hotline and make appointments at the designated clinics. We have prepared information package for these patients. The packages will be delivered to them via logistics companies. And also you can log on to our website for the latest information. The infectiousness of the patients would reduce over time, especially for those who have been vaccinated, and the risk posed to family members would reduce over time. For patients with mild symptoms, their health condition would improve gradually. To play safe, we recommend a rapid test on the 14th day at home. If it is negative, then we believe that the patient will have recovered and he can resume any normal activities. For family members and household members, according to the Stay Home Safe plan, they should undergo 14-day quarantine at home. The HAD the HAD is running a hotline to provide support. For patients who have yet to receive an information pack, please find the information online. Our team and our contractors will deliver the information packs to your doors as soon as possible. Because of the increase in the number of active cases, we need to continue to impose social distancing measures. Do avoid going out and unnecessary gatherings, including cross-household gathering. For those who are yet to receive a jab, please do so soon. If you need a third jab, then please get a third jab. Vaccines can effectively reduce the risk of complications and fatality, as well as the risk posed to your family members. To protect newborns, if there are no other contradictions, pregnant women should also get vaccinated. We want to get the information of preliminary positive cases and your family members as soon as possible, so that we can assist your stay home safe isolation period. So please give us your information via the telephone so that we can help you. If you are not tech savvy, we will get in touch with you via the telephone. And please wait patiently. I would like to thank our colleagues, including government colleagues as well as volunteers. In the past 2 years, especially during the recent wave, they have been providing the best services to members of the public. I also call out to major corporations to join hands with us and fight the disease. We hope that major corporations can organize volunteer teams to support your colleagues who are infected, including disseminating information, distributing rapid test kits to alleviate their concerns. We urge members of the public to stand together with us in this fight and overcome the epidemic. Thank you.
Dr. Chuang will tell us about the latest situation about the cases. As of last night, the HA lab and the CHP's lab confirmed a total of 6,067 cases. 2,733 such cases were confirmed by the Hospital Authority lab. 3,334 cases were confirmed by the Center for Health Protection's lab. 32 cases were carriers of the L452R strain, meaning suspected Delta carriers. 3,188 cases tested negative to the strain, meaning they are suspected Omicron carriers. 114 cases are pending tests or could not be tested due to the low viral load. For the 6,067 cases, 12 of them were imported cases. The rest of them, 6,055 of them, were local infections. In terms of the trend, you can refer to the figures we reported every day. From the 15th to 17th February, the daily case count was around 4,000 cases per day. On the 18th of February, we got 7,000 or so cases. As at yesterday, we got 10,000 or so cases. The overall trend is an upward trend. Social distancing restrictions have been put in place, and there may be a need for such measures to stay in place. For elderly care homes and care homes for the disabled, we have more than 240 such cases that have reported one or multiple infections involving residents or staff members. As of yesterday, at least 197 staff members and 672 residents have tested positive to either a PCR test or rapid antigen test. That's all from me for today. Over to Dr. Sarah Ho. Good afternoon, everyone. As of now, we have 3,701 patients testing positive or preliminary positive, receiving treatment at the North End Hospital, Hong Kong Infection Control Center, Hospital Authority, Infectious Disease Center, and the Asia World Expo Community Treatment Facility. We have close to 2,300 patients staying at the Penny's Bay Community Isolation Treatment. More than 200 patients are staying at the Tsuen Wan Community Isolation Center facility. 14 patients have passed away. 227 patients were discharged upon recovery. At the isolation beds in the public hospitals, the occupancy rate is over 90%. That's the maximum capacity at which we can receive patients. I want to make an appeal to all sectors of our community. Let's support our healthcare workers in overcoming this crisis. First, we called upon private sector healthcare workers to join us. We are aware that many private hospital workers stand ready to help us in various ways to take off some of the pressure on public hospitals. The hospital authority have liaised with private hospitals and the associations of such hospitals. We are discussing relevant arrangements, and we will implement the arrangements as soon as possible, and hopefully that will help our public. In the previous 4 waves of outbreaks, we had all kinds of collaboration with private hospitals. We had public-private collaboration schemes where we referred patients to private hospitals for care. This helps a lot in taking off pressure on public hospitals. In the days to come, we will step up communication with private hospitals. One of the plans under consideration is to get private hospitals to help us look after patients who are recovering so that we can free up more manpower and beds in public hospitals to fight COVID. Second, we want to thank all government departments and bureaus for all their help over the past few days in sorting out the problems involving the patients waiting outside A&E departments for hospital admission. We will continue to work with government departments to deal with all the problems that may occur, including by identifying more indoor areas and premises and turn them into community isolation facilities and transporting and supporting patients. I believe all departments will work with us in dealing with the COVID crisis. Third, I want to thank our frontline workers. This is a very trying time and exhausting experience for our workers who work tirelessly in looking after patients. They don't even have time for a meal break. I want to thank them wholeheartedly. We will keep reviewing the work environment and arrangements, and we will look into ways to help our workers do their job. We will look into ways to relieve some of the stress and improve the work environment, and we will consider such options. I also want to take this opportunity to let patients waiting for hospital care know that I know you're waiting a long time before you can get to see a doctor. I know many people are upset, and it's hard for you. I understand there may be frustration, but please do not take it out on our workers. Our staff members work very hard to help you, but there is a surge of patients at hospitals. No matter how hard our staff workers work, some may be left disappointed. I call for mutual understanding on the part of the public so that our workers can focus on looking after patients. The floor is now open to questions. Before putting your questions, please tell us your media organization. The journalist at the back, the journalist in black. Now TV. First question. You said that social distancing measures will remain in place. The measures were tightened 10 days ago, but we're still seeing cases going up every day. Does it mean there's a falling behind in the restrictions and the rise in cases? Is there a need to further tighten the restrictions? Now you have moved patients waiting outside hospitals into indoor areas. But where are you keeping the patients now? Are these indoor areas up to the standards required of isolation facilities? If you move them inside and the places are not up to scratch, wouldn't that add to infection risks? You also mentioned collaboration between public and private hospitals. So some recovering patients may be referred to private hospitals, as you said. So what's the position of the private hospitals? What kind of services and patients will be referred to private hospitals? I'll take the question about the social distancing measures, and Dr. Sarah Ho will tell us about the hospitals and the private-public collaboration. The social distancing measures as they stand and the case count so far. Over the past 5 days, as Dr. Chuang was saying, the first 3 days, the daily case count was relatively stable, roughly 4,000 cases or so every day. But as of the day before yesterday, the daily case count rose to 7,000. Just then, we reported roughly 10,000 reported cases. So that's an upward trend. We will have to observe the situation for a longer period of time. The communicable period will last for a few days. So we will have to closely look at how things go in the next week or two before we can tell whether we can contain it. Social distancing measures requires public cooperation. As we made our appeal just then, we're asking people to avoid going out, avoid unnecessary gatherings, especially cross-family gatherings, get vaccinated as soon as possible. These steps will help us flatten the curve. Let's work together. And we will keep in view on the daily case count in the next few days. Over to Dr. Sarah Ho. We're discussing matters with private hospitals. They are very positive and they're willing to help. They're willing to help the hospital authority and fight COVID together. We have discussed various proposals. One such proposal is to have recovering patients taken care at private hospitals, but discussion is ongoing and we will discuss the various aspects of the proposals. And hopefully we can agree on all kinds of options to offer care to patients. And we also mentioned about letting patients wait indoors at hospitals. We're using the space at physiotherapy areas or staff break rooms to let patients wait indoors. There are basic ventilation equipment in these areas, but we will also take steps to improve the ventilation. So we will have portable purifiers or HEPA filters in those areas, and they will help reduce infection risks in those areas.
Okay.
Next question, please. The reporter in green, cable news. Now about the occupation rate of ICU, what's the utilization rate? If there are more critical patients, will we run out of ICU units? How can the HA deal with the problem? And how many critical and serious patients do we have today? Now since the 17th this month, the HA in the daily press release, the number of critical patients were not mentioned. Why is that? And the HA will provide guidelines for confirmed patients on how to keep safe at home. So when will we have the guidelines? Now in terms of patients waiting at home, I will defer to Dr. Sarah Ho about the number of ICU units and the number of critical patients. If you look at the number of cases and the number of facilities we have, inevitably for mild patients or patients with no symptoms, they will have to stay at home before hospitalization, and maybe they would have recovered before the 14 days period end. We have to reserve our beds for patients with high risk. As announced on our website, we are telling patients what they should pay attention to if they are waiting at home in terms of infection control, how family members can offer help. We also want to provide rapid antigen testing kits to the patients at home. On the 14th day, if the antigen test come back negative, it means that they have recovered and they can leave home. And no isolation arrangements will be offered. So this is a pamphlet like this. It is also available online. For patients waiting hospitalization, you can download these information from our website. Dr. Ho? The utilization rate of our ICU is about 60%. As our chief executive of the HA mentioned, during the Omicron wave, patients often have mild symptoms. So the number of Omicron patients requiring ICU treatment is lower. For elderly patients, however, some of them require further treatment. We would discuss with their family members in terms of the best course of treatment. When a patient is moved into ICUs, there will be invasive procedures involved. So we will have to discuss with the family members on whether it is the best option. In terms of number of critical patients, we have more than 10 confirmed patients in critical condition. For patients in serious conditions, there are a score of them. Because of the sheer number of patients, we will give you an update in a consolidated manner as the press briefing. The lady in the middle. Good afternoon, TVB. Now you said the number of serious patients are several tens of them. So how many exactly? So you said the current social distancing measures would continue. However, Professor Sophia Chen said today that the social distancing measures might be further tightened. The measures, as they are already very stringent, so how will they be further tightened? Will you consider a full-day dine-in ban? In terms of testing, because of the shortage of manpower, people have to wait a long time to get the results. According to the experts from the mainland, after the logistics issues are sorted out, they will start testing work immediately. Today, the specimen taking teams are still sorting things out, and they are not offering their services yet. So when will we get the help? And vaccine pass will be put in place soon. Security guards at malls will not check people's vaccinations records. So how effective will it be? You said only when it is necessary will law enforcement agencies enforce the law in restaurants and malls. So why are there different standards for restaurants and malls? I will take the first three questions and then I will defer to Dr. Ho. Now the social distancing measures are mentioned. According to our judgment, amidst the rising trend, we can definitely not relax the measures. They will be maintained or even further tightened. If we are to tighten the distancing measures, there will be several options. For example, minimizing the a period of minimizing the dine-in period. So we will work together with the governments to see whether we have to tighten the measures. At least the measures will have to be maintained. In terms of testing capacity, as you can see, we have been increasing our local testing capacity from 100,000 per day. The number has been rising rapidly. Now we have the mainland teams. We hope that we can have the input soon and ramp up our testing capacity. In the past, you may get the results in 1 day or 1.5 days. Now the time required will be lengthened. Now with the enhanced testing capacity, the waiting time will be reduced again. In terms of vaccine pass, I think we understand that we are trying to encourage or use stricter measures to tell people that vaccination is indeed critical. For high-risk place where you have to take your mask off, we will be even stricter. We have to ensure that people who enter these venues are vaccinated. For other places, it is rather difficult to check whether people are vaccinated. So we are relying on people's self-discipline. If you are entering malls, after the vaccine pass scheme is implemented, if you are not vaccinated and you enter a mall, you will be breaking the law. So we may have law enforcement agencies performing checks at these venues. So I call for the public's cooperation. We also call for the cooperation of malls to make sure that visitors have been vaccinated indeed. And the situation is indeed serious. We rely on collaboration from property management companies and malls and people's members of the public to help us.
For patients in serious condition, we have dozens of them. But I believe you can understand that there has been a surge in the number of patients. Some tested positive, so others tested preliminary positive. Our staff focused on treating the patients because we will require other staff to compile the figures and update them. Next question, journalist at front, the journalist in beige. Phoenix TV. Over the past 4 days, we have seen the daily case count has exceeded 6,000. If the increase goes on, does it mean that it would be hard to prevent the recurrence of a situation where patients have to wait in the cold outside hospitals? We have also seen recent reports that patients at A&E departments, one healthcare worker will have to look after more than 60 patients. Do you have the stats? Like how many patients does each healthcare worker have to look after? Are there ways to alleviate the problem? We have seen infections at care homes. Some residents have been in quarantine at Asia World Expo for 7 days, and then they're asked to return to the care homes to complete the remainder of the quarantine period. But are the care homes suitable for the quarantine? Wouldn't that add to the infection risks for other residents staying at such care homes? I'll take the question about Asia World Expo. Dr. Sarah Ho will tell us about the situation at A&E departments. In terms of the daily case count and the trend, we expect many cases to come up. Whether it's hospital admission or home quarantine, there are things the public should watch out for. As for the Asia World Expo, the quarantine, we're trying to strike a balance between the number of patients that we can accommodate at the Asia World Expo and other things. There may be residents of resident care homes staying at the Asia World Expo. After 7 days of quarantine, we believe the risk of an onset may be lower and low enough. But there's also a need to take in people maybe at a high risk of an onset. So this is a risk assessment, and we need to strike a balance here. We need to maintain a balance and make sure the risk is manageable. So that's why some residents are sent back to the care homes after 7 days so that we can free up the space to receive residents who are at a higher risk. And after a resident is sent back to the care home, we have infection control guidelines that will be made available to the relevant care homes to help them lower the infection risks and what to do if there's a reinfection. Especially when it comes to things to look out for when the staff look after the residents. Over to Dr. Sarah Ho. As you are aware, there are thousands of infections every day. So this is a huge base number. Even if 10% of such patients go to A&E departments, that's huge demand on A&E services. So we try to get patients waiting to stay indoors. It's cold today and it's raining. If there's a surge of patients arriving at A&E departments, we will be hard pressed to get everyone indoors. So we do our best. We try to show empathy in our approach. And in terms of our staff manpower at A&E departments, it's stretched. Given the surge in patients, we're under tremendous stress. But we will keep in view the situation, and we will deploy our manpower and where necessary. So that's all from me. We'll take an English question at the back, far end.
TMHK. So, Health Secretary Sylvia Chan said the government is looking into tightening social distancing measures. So what kind of measures are on the table right now? And regarding the overall virus situation, do you think that the daily COVID figures really reflect the full picture, given that some infected people are still waiting to get tested? And thirdly, you mentioned the electronic COVID reporting form. Can you explain how it works? And also for hospital authority, how many patients are still being left outside the public hospitals? And can you give us more details regarding plans for private hospitals to help fight the pandemic? Will the government consider buying beds from private hospitals, and how will they decide who will be transferred to these private hospitals? And lastly, about complaints made by some low-income families. They say that they've been waiting for a long time during home quarantine, and they said they received little government support after some of their family members got infected with COVID. So does the government currently provide any support to these grassroots families under home quarantine? And will those living in cramped living conditions get priority to be sent to hospitals and isolation facilities? Thank you.
Okay, thanks. So our first response to your questions on the home quarantine and also for people waiting to hospital, and I will let Dr. Ho to address to the hospital situations. Yes, indeed, we have some information for the home quarantined confinees and also for those who are waiting to the hospital. And indeed, we have different hotlines which can cater for different needs of different people. So this is one of the 14 days home quarantine booklet which we have imposed to the website. And we are also delivering these packages with the rapid antigen tests and also the thermometers to those under the home quarantine. But yeah, because there's a surge of cases and also there's a surge of home quarantine confinees need in Hong Kong. So we are expediting our delivery schedules, including we will invite some companies for the delivery work for us, so that we have to deliver all the packages to the people under quarantine and those waiting to the hospital more quickly. So for the testing arrangement, yes, we are upgrading, equipping our testing capacity. Yeah, maybe, with the help of the mainland experts. So we expect the testing capacity will increase soon. So to cater for the need to test, and also because of the rising trend of the reported case in Hong Kong. So I'll let Dr. So, please.
So in view of the cold weather and also the raining situation, we have mobilized all the available indoors area, including the day center and also some physiotherapy departments indoor area, to let the patients move indoor instead of outdoor. And at the moment, only a few number of cases while waiting for the triage staying indoor. But at the same time, if there is a large influx of patients, inevitably some of them may need to wait for a while. And for the private hospitals, and they show positive to help to take care some of our patients. The initial directions are taking care of those convalescent patients, and so that free up some capacity in hospital authority to take care of COVID confirmed and preliminary confirmed patients. And for the patients, while they are waiting to be admitted, for those preliminary confirmed patients to be admitted, we set up some hotline so that they can call to inquiry about some infection control or general information. In case they have symptoms, they can pre-book the designated clinic so that we have some doctors there to provide medical consultation to them.
I'm sorry, I forgot to answer your question about the electronic forms. Yeah, we spend quite resources to call all those home confinees and cases to obtain the information about their home confinees named and also the address. So we are enhancing these measures by using an SMS message to the cases, so that they can reply us through an electronic form, and they can fill the information to us, like the number of home confinees, the name of the home confinees, and the exact address, so that we can deliver all the packages and to further communicate with the home confinees more speedy.
Another English question.
Yes, I do think the current figures reflect the trend of the infection and spread in Hong Kong. Yeah, because Hong Kong people are quite concerned about this virus, and they are eager to go to test. So what we need to do is to equip our testing capacity to cater with this increasing demand.
Good afternoon from SCMP News. I would like to know, for the 14 deaths today, can we have a breakdown on the age and gender, and whether how they are all vaccinated or not? And also the same for the serious cases and critical cases, what's the age and the gender breakdown? And also in terms of getting the private hospitals to help, how many more patients can these private hospitals receive in total during the wave? Thank you.
Okay, so I will let Dr. Ho to respond.
For those death case to date, we have around 10 patients. All majority of them are elderly, and their age range is 70 to 98, 7 male and 7 women. And for those serious, we have also few dozens of cases, and majority are also elderly. For the preliminary contact or discussion about the arrangement with private hospital is still in the preliminary stage. The initial direction is to transfer those convalescent patients to them. The estimation of the scale and number are still under discussion.
Okay, so I'll allow Dr. Zhang to respond.
We found that the preliminary positive case does not reflect actual trend because some of the preliminary positive case, they have been preliminary positive for quite a while because the specimens were not sent to our laboratory. So we try to use the daily notification figure to reflect the actual trend. So the figures are reported just now.
下一題，呢邊前面呢位。
Next question, please. The reporter over there. Hi, Hong Kong 01. Now, in the community, many people have been tested preliminarily positive by self-test. However, they can't get a bottle for a confirmative test. At collection points, bottles are cleared out quickly. So how can we ramp up the capacity? Now, according to the public, the support hotlines or the hotline to book a place at designated clinics, they can't get through. And so how can we solve the problem? So according to anonymous reports, there is a ward where 20 to 30 patients, including medical staff, infected. So can you confirm the report? About the demand for rapid antigen tests, I will address the issue, and then Dr. Ho will answer another question, and Dr. Zhuang will tell you about the Port Oil Hospital situation. Now, the demand for rapid tests is huge. Many people are doing tests themselves. We want to do confirmatory tests on these rapid tests because it is not 100% accurate. When the number increase, more follow-up work will be required. For example, dispersing deep throat saliva specimen bottle. And also we are devising ways to follow up on preliminary positive cases discovered by self-test. More details will be available soon on how we will follow up on these preliminary positive cases. Dr. Ho? About designated clinics, as at yesterday's afternoon, the 7 designated clinics for COVID-19 cases have received over 3,200 patients. Consultation and treatments have been offered to them. Every day, we are issuing more than 1,000 tickets. Yesterday, some 800 patients received treatment. In some districts with more cases, the demand would be higher. Depending on the situation, we may increase the or extend the service provided by designated clinics in certain districts. Most of the patients have mild symptoms. They only require simple medications to help them. In terms of our telephone hotline, we are also enhancing the service. We will pay attention to the number of callers, and we may expand the service. We have a lot of help from nurses, pharmacists, and our allied health teams. We hope that more colleagues will join us. In terms of the Port Oil Hospital situation, I don't have any information right now. More details will be available after investigation. Next question, the gentleman in the middle. Hi, AM 730. Now, you said the number of cases has been on the rise. So besides of community isolation, is it because of the sheer number of CTNs issued? That's why there is a delay in terms of returning testing results. Now, patients on convalescence, are they from hospitals with A&ED or those hospitals without A&ED, how many patients will be received? Now, you said the entire hospital may be converted into a COVID-19 patient's hospital. So under what circumstances will we activate this plan? Now, for the critical patients, what are the ages and how many patients were transferred from designated clinics? Finally, about collecting patients' information via the electronic form, how will it work? Will the CHP call the patients, or will they just receive an SMS? And how can we avoid fraud or the fraudulent cases? Now, about the trend of cases and about the arrangement of SMS notifications. Now, about the rising trend. It certainly has to do with the community outbreak. When the base number is huge, when one patient can infect 3 patients, then we will have a lot of cases. On the other hand, we have transmission within families. If one family member is infected, the other family members will be infected as well. And also, the number of isolation facilities cannot catch up with the need. Ideally, all confirmed cases should be housed at isolation facilities. Because of the bottleneck we need help from family members. Positive patients may have to stay home and lower the infection risk by adopting our instructions, our guidelines. Well, 2 days before the onset or during the incubation period, other family members might be exposed to risk. So even if family members are infected, don't be overly anxious. Just pay attention to your health condition. So like Dr. Sarah Ho said, if you have no symptoms or mild symptoms, you shouldn't rush to A&ED and join the queue, because we have a different medical needs. So like our pamphlet said, if you are confirmed, you can adopt measures to lower the infection risk to other family members. If there is any change in your health conditions, of course, you have to seek medical assistance. We have hotline and we have dedicated clinics to offer help. In the near future, when we are able to increase the number of isolation facilities, then high-risk patients, especially those with high viral load during the initial period of infection, or those from high-risk groups, will be moved to isolation facilities. About the SMS, that's one way to help our tracing work. Previously, we would call each and every case for the information, including the constitution of the family members, the names and ages, and so on. When the workload is heavy, even if it's just take 5 minutes for each call, we will never catch up with the cases. So we are relying on technology here. For members of the public who are able to fill in the electronic form, please fill in the form and at least let us know how many family members are there, and then we can deliver the packages to your door. We are treading very, very carefully because we don't want the system to be exploited by criminals. Patients will get a SMS. So if they can fill in the electronic form, it will surely help our work. When we want to remind patients about the government's instructions or so on, we would do so by SMS as well. We understand that some people are not tech savvy, so we would use the conventional way, that is call the patient up. We will adopt every measure to speed up our tracing work to cope with the number of cases. Dr. Ho?
For patients in a critical condition, I do not have a detailed breakdown. Most of them are the elderly. For those relatively younger, they suffered from underlying illnesses, turning to designated clinics. Patients who require transfer to hospitals, well, I don't have the data on such cases, but for designated clinics, these are clinics for those symptomatic patients but with mild symptoms. Based on what I have now, most of them got some medication and then returned home. And as to the kind of patients that may be transferred to private hospitals, these are patients, recovering patients, or those under infirmary care. They may be found at A&E departments or one of our infirmary care institutions. So this will require further discussion between us and the private hospitals. We would discuss in detail about the number of patients, etc., because this is just a preliminary plan as of now. There's huge demand for hospital care. After all, we have many confirmed patients or patients who test preliminary positive. Government departments are identifying suitable premises for community isolation facilities. We are considering many different proposals. One, for example, designated places for preliminary cases of COVID patients. We are considering different options. Next question. We'll take two more questions. At the back, the gentleman there. Ming Pao. First question for the hospital authority. Can you give us a breakdown of the isolation facilities under the hospital authority? And for the patients who passed away, how many of them were vaccinated and how many of them were unvaccinated? And a question for the Center for Health Protection. Just then you mentioned the use of SMS to ask members of the public to provide information. Do they just have to provide their names, the size of the household, and their address? When will this measure kick in? We received a complaint. The wife of this complainant tested positive on the 9th of February. They underwent 10 days of home quarantine, and only then they got a call from the CHP, and they were required to undergo another 14 days of quarantine, so they had to stay home for an entire month. So they were wondering if the authorities failed to consider that they were already under quarantine for some days. What's your response? What's the response from the CHP? If a close contact underwent quarantine before receiving the quarantine order, do those days not count? Is there a delay in the handing out of quarantine orders? Just then, other journalists asked for preliminary positive cases. So are you going to stop announcing the preliminary positive cases? Why? Will this remain the case forever, or will you announce preliminary positive cases again once we have fewer cases? I will first address the point about the use of SMS and then the complaint, followed by the figures announced every day. And then Dr. Ho will tell us more about the other things. The SMS will not, as the measure is not in place yet. When we had fewer cases, we could rapidly reach out to the patients over the phone and get that information. But every time we make a call, it takes time. When you have many cases, calling people up will lead to delays. So we are considering other options, such as getting the patient to fill in essential information, the number of family members in the household, their names, the phone number, so that we can reach their family members by phone. That will facilitate our tracing efforts. We are preparing this measure about the use of SMS. We have to liaise with the service operators for the SMS, and we also have to prepare the electronic forms. We used the electronic forms in the past. For example, health declaration for those arriving at Hong Kong. It's similar to the electronic form we have in mind. The form, once submitted, will be stored on the government cloud and it will only be accessible to government staff. The technology has been in use, but has not been in use for our contact tracing efforts. And the use of such technology may facilitate our efforts. Regarding the complaint you just mentioned, I hope this journalist can give me further details about this case. I cannot give you a detailed response regarding the reason based on what I've just heard. In some cases, when you have a positive case, it may take time for staff to find out how many family members this patient has. So that's why we're using this electronic form and we're considering this. In terms of calculating the quarantine period, we start with the last date of contact. If there's a delay in reaching out to a patient, we don't start with that day. For those extra lengthy quarantine periods, I may have to get our team to look into the case for the specific reason. If other close contacts are involved in the certain case, then the clock starts again. It will be different. So I need to get the specifics before I can give you a response for that case. We're not trying to withhold the information about preliminary positive cases. We have many cases every day now, and there are delays in different parts of our testing. The preliminary positive case count will not accurately reflect the trend in that case count. That's why Dr. Chuang was saying that by a trend, we're talking about two things. First, the case is confirmed as of yesterday. These specimens may be received before yesterday, the day before yesterday, because we need 24 hours to confirm the specimens were received. And then there are also the preliminary positive specimens we received. That's the figure reported by Dr. Chuang just then. And that's the best way to reflect the case count we have on any given day. Because we were trying to show you the trend. So over the past few days, we started with 4,000 cases or so per day, and then 7,000 cases or so, and then yesterday we got to the point of 10,000 cases or so reported every day. So that figure included the preliminary positive figures. So we're not trying to withhold any information, but we're trying to show you what's useful to help you see the trend in case count.
Dr. Sarah Ho. I repeat, we have 3,600 confirmed and preliminarily confirmed patients hospitalized in the public hospitals, and we have 2,300 patients isolating in the Penny's Bay treatment facilities, and another 200 patients in Tsuen Wan. For patients who passed away, under the current circumstances, because of the shortage of manpower, we focus the manpower on dealing with emergent patients. So there may be a delay in terms of the information update. So we will try our best to keep you updated. The last question, the lady in the front. Good afternoon, Oriental Daily. Now about infants and pregnant women, if there is no contradiction, they should get vaccinated. So what is the definition for infants? A few months old or a few years old? And about stay home safe, how many patients are there? at home, and about the details of the deceased patients. Were they vaccinated? Can you tell us again? About the private hospitals, do they not have any negative pressure facilities to take in COVID patients? Is it really the case that they can only take patients on convalescence? How many patients will benefit from the partnership? And do we have patients who have already waited 14 days at home and can leave home? Now, today, every day, we still have CTNs and RTDs. There are so many patients tested preliminary positive each day, but we lack the manpower to deal with them. So what's the point? And do we have patients who caught the disease during the wait for a test? There were patients who have waited for 6 to 7 hours for a test. Despite the ticketing measures, is there still a risk to patients, to people waiting to be tested? Now we will take the first question. I reiterate, I didn't say that newborns should get vaccinated. We all know the eligibility age for children to get vaccinated. According to medical journals, pregnant women are at high risk. There were pregnant women who hesitated to get jabbed because of the possible side effects. So I would like to remind pregnant women, if there are no contradictions, vaccinations against COVID-19 will help.
如果咧佢打咗疫苗之後，
If you have no contraindication, vaccines will help. It is a protection for you and the infant or the embryo. If mothers are protected, then the protection would be transferred to the baby as well. So I'm not saying that babies as young as a few months old should get jabbed. About the number of patients at home, Dr. Zhang will take the question on how these patients got infected. Since we have so many cases in the community, it is really difficult to single out the sources, including during a meal outside or otherwise. The point is we have to maintain social distancing and reduce gathering. That will definitely help containing the epidemic. Now, RTD is still necessary when there is a major outbreak, when we are worried about a building where there are a lot of cases. We want to find out all the cases, and then we will do a screening. If we judge that it is not suitable for patients to stay at home and need treatment or isolation at hospitals or facilities, the RTD will surely help us find out these patients. So the current measures are still effective. Dr. Zhuang, as at last night, we have 10,416 patients staying at home. I don't have the vaccination records of the patients who passed away today. Dr. Zhuang mentioned the details yesterday, so please refer to yesterday's briefing. On private hospitals, we have received very positive and enthusiastic response. The initial thought is to transfer people in infirmary care and on convalescence to private hospitals. We still need to meet up with private hospitals to formulate the plan. That is the end of the media briefing. Thank you.